On WNIN Lawmakers this week, our guest is Indiana State Senator Vaneta Becker. We'll be talking about what's been happening in Indianapolis so far this year, and we'll take a look at the Indiana vaccination effort. That's coming up next on WNIN Lawmakers. Welcome. I'm John Gibson, Morning Edition host for WNIN FM. The COVID vaccination efforts in Indiana have been one of the best in the nation. Here's a detailed update of the progress from the Indiana State Health Commissioner, Dr. Christina Box.
11,000 Hoosiers have received their first dose of vaccine as of today. That's an increase of 134,000 from last week. Of those individuals, more than 166,000 have received both doses and are fully vaccinated. More than 875,000 unique Hoosiers ages 65 and older, along with our healthcare workers and first responders, have been vaccinated or have an upcoming appointment. That includes 56% of Hoosiers age 80 and older, 62% of Hoosiers ages 70 and older, and 46% of Hoosiers ages 65 to 69. This number also includes about 63% of eligible healthcare workers and first responders. In addition, nearly 43,000 residents of long-term care facilities have received their vaccine, along with nearly 17,000 staff in these facilities. It's incredibly gratifying to see the overwhelming interest in the vaccine, and it's amazing to remember that just 2 months ago, we didn't have a vaccine. Many of you have heard about the National Pharmacy Vaccination Program that will bring an estimated 20,000 additional doses to our state each week. We welcome additional doses of vaccine in Indiana, but continue to support the state-based system of distributing vaccine to ensure that all vaccination sites are following Indiana's eligibility criteria and to avoid confusion for Hoosiers trying to register for their vaccine. As a reminder, Indiana has created a robust, centralized scheduling platform that allows eligible Hoosiers to register using ourshot.in.gov or by calling 211. As long as vaccine supplies remain limited, we will continue to prioritize individuals who are most likely to be hospitalized or die from COVID-19. As we have mentioned several times, people age 60 and older account for 64% of our hospitalizations and 93% of our deaths. Dr. Weaver and the advisory committee are also studying when and how to prioritize people with specific health conditions. Moving forward, the committee will examine the data to determine at what age the risk due to age starts to equal the risk of our other comorbidities, like obesity and heart disease. This will help inform our vaccine eligibility categories going forward.
Today, our guest is Indiana Senator Vaneta Becker, who represents portions of Vanderburgh and Warwick counties. But before we begin our conversation with Senator Becker, here's a quick update from Indianapolis. Indiana Public Broadcasting's Brandon Smith reports on the week at the State House.
Legislation approved by the House Public Health Committee this week would double the state's cigarette tax from $1 to $2 per pack. It would be the first increase in that tax since 2007. The bill also creates a new tax on e-liquids used in vaping. A measure that unanimously cleared the Senate this week would permanently expand telehealth services that Governor Eric Holcomb temporarily allowed during the pandemic. The bill's author, Senator Ed Charbonneau, called the measure transformational. At least one health system saw a 6,000% increase in telehealth visits last year with just the temporary expansion. And a Senate committee passed a bill to require nursing homes to allow designated family caregivers to visit residents, even during lockdowns like those seen during the pandemic. Those family members would still have to follow any screening, testing, and PPE procedures nursing homes require. For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
Senator Becker, we certainly appreciate you joining us today.
Thank you. Nice to be here.
Good, good. Well, now you recently had, I guess what you might call a COVID exposure scare. You tested negative, and as I understand it, you got the first dose of the vaccine, and you're about to get the second dose.
That's right.
Well, can you describe that experience for you, both the quarantine and getting the vaccine?
Well, with the quarantine, it was actually my husband that had the COVID, and so he had called the clinic and they gave him a Z-Pack. He thought he just had a sinus infection, but then he got tested on Saturday and it showed up on Sunday that he was COVID, he was positive. So I had to quarantine for 10 days and all that. I cooked a lot more during that time than I normally do. And then, fortunately or unfortunately, but fortunately for him, we were not in session that next week, the second week, so that helped. And so he's doing great now. He had the monoclonal antibodies, the Eli Lilly treatment, and he's doing great. He's back to doing everything he does, and so I just really, and then I had to wait 5 days to be tested, and I came back negative. And so then I had my first booster shot, or my first vaccine, that next day on Friday, and I'll get my second one today.
Sounds good. Well, let's talk about now that you mentioned the Capitol was pretty quiet there for a week, but it's certainly been busy since then.
Right.
How do you feel the state has been doing in response to the COVID-19 pandemic?
I think they've done a very good job. If you look at the statistics, and we had a Zoom call because I serve on the health committee. We had a Zoom call a week ago Monday, and one of the interesting statistics that showed up, it showed that Indiana at that time was second in the country as far as the percentage of people getting their shots, their vaccines. But it also, at the end of that program, I asked Dr. Box, I said, tell us about how the flu did this year. And she said, well, a big difference. She said last year between September and December, they had 500,000 people that had the flu. I think it was 500,000. This year they only had 1,000, which is wonderful because, and I think it was just because we've been wearing masks and doing social distancing, and a lot of people not traveling a lot.
Right.
And also they encouraged people to get the flu shot, and I think a lot of people took it seriously this year.
I see. Well, speaking of the pandemic emergency, there are some efforts at the State House right now to limit the governor's ability to make emergency declarations, or at least the length of them, that kind of thing, by requiring legislative approval for long-term emergencies, such as the one we're in. How do you feel about those efforts? The idea being that you'd have to call an emergency session of the General Assembly if the governor declares an emergency.
Well, he could, I think under one of the proposals, he would have 30 days and then the legislature would have the opportunity to respond. Quite honestly, I think he's done a very good job under extreme circumstances. I'm not sure that 150 people are qualified to make some of those decisions, but we'll see what happens. I just think we have experts in healthcare that we rely on. I think one bill that is on third reading for next week is Senate Bill 5, and I do appreciate that. And what it does is it puts the pressure on, instead of a local health department making the decisions as far as closing businesses, they could make that opportunity, but if somebody wants to appeal that decision, then it would be up to county commissioners as to whether or not they want to keep that in place or not. And I think that might be a good idea because they're elected officials and the boards of health are not. And so we're probably going to pass that unanimously.
And does that also then allow that 30-day period there where the General Assembly then can come back and...
No,
This
it
is something
doesn't.
else?
That's just, it's for local businesses, and it would allow already, when this passes, the local, if you live in a city or a town, small town that doesn't have county commissioners, but you have county council, then they would be the ones making the decisions. Now, they could say right away, we don't like that, or we support it, and it would continue on. But it would at least make it accountable to elected officials.
Right. So are you okay with that idea of maybe, limiting the governor's power somewhat?
It would depend. I think probably there needs to be some time limits. I didn't like the way, especially in light of the fact that the state received over $2 billion from the feds, and we were not in the mix when it came to how that money was being spent. And I think that is one of the legislature's responsibilities, and I think that at least the Senate Finance Committee should have been involved in those decisions, and actually the legislature. So some of the powers, I think, have gone a little too far, but all in all, I think the governor's done a good job.
Yeah. Well, let's talk a little bit about not only the health of Hoosiers, but the financial health of Indiana. As you see it, how has the pandemic affected the financial health of the state, and what direction are we headed?
There are a lot of people still struggling, and there are a lot of people that still haven't had their jobs back, and I am hopeful, optimistic that the feds will pass the COVID relief package that's before them right now. It needs to happen. If you talk to economists, they think it would be very positive for people, and that would provide funding for schools that have been shut down, would help them. One of the things that we're doing at the state level to help schools is Senate Bill 2, which I certainly did support, and it allows as long as you are in bricks and mortar school, if it's virtual, they will be funding them 100%. Right. This year, so that they won't be cut. But there are some other education bills that I do not support, that take money away from public education. Senate Bill 412, Senate Bill 413. There's a bunch of them, and what they're doing is wanting just to provide grant programs and a credit card to a parent, and they can do whatever they want with it.
Now, I think some folks have pointed out that in that education measure, or measures like it at least, where virtual gets as much funding as brick and mortar, can that be made permanent? Would you like to see that sort of situation permanent? And why not?
Because virtual is a lot cheaper. They don't have to take care of buildings. They don't have to pay utility bills. They don't have to pay for cleanup of a building and repairs. So no, I don't think they should ongoing get the same amount that you pay for brick and mortar, because brick and mortar has fixed expenses that once you get your hookup on a virtual school, that's it. You have your computer and they provide the computer, and that's it. So I think we'll go back to 85%.
I see. Once we're past the pandemic.
Once we're past the pandemic. But I also think there needs some more accountability for virtual schools, because we have found a lot of what's happened statewide is they've received funding for kids that were never there. And there's been some, I think it was Daleville, and we've had some others where they are investigating them. They're bringing charges against them because they have received compensation for millions of dollars without even having any students.
Now, as far as the school funding and the virtual versus bricks and mortar, there's all of that, but also rural broadband, another tech area here. And one thing that the crisis has certainly highlighted is that importance of expanding rural broadband. At least that's what many people say. I believe Senate Bill 264 passed the Senate unanimously. How does that bill, basically what will it do, and where does it go from here?
It sets up that's Senator Cook's bill, I believe, and it sets up a study committee to look at how they're doing the grants. I know that the governor has, and the budget bill will have, an additional $100 million in this year for expanding broadband throughout the state, and we do need to do that. It's critical. All we have to do is look at what's happened this last year, and all the Zoom meetings. I've had more Zoom meetings than I can count, I think
you never thought you would have, right?
That I never thought I would have, and really didn't know how to use until this past year, but we're all learning.
Yes,
so
indeed.
I think we need to have better broadband. It needs to be in rural areas. We've found some rural areas where kids have had to go to McDonald's parking lots so that they could get online. Right. And that shouldn't be the case. We need to do a better job and spend money in that area.
Well, speaking of money, this is a budget session of the Indiana General Assembly, of course, in the midst of a pandemic. What are your priorities in the upcoming budget?
Well, my biggest priority is K through 12 public education. I think we need to do a better job there. And also we need to be doing something about giving teachers a pay raise. And that's on the governor's agenda, and there are ways to help in that area. But we need to make it a priority. We end up doing the things that we think are important enough to do. And I think providing, right now we're below all the states around us as far as teacher pay.
Right.
And we're losing teachers, and the conditions haven't been great. One of the things I would like the Board of Health to do is to give teachers the vaccinations earlier than what they've been doing.
Yeah, that is an issue that I've heard from quite a few teachers, that other states are prioritizing
Right.
teachers, our state maybe not so much.
Well, they're not. They're looking at age, and I guess that's one way to do it. But I also think we should include teachers as quickly as possible, because, I think what the science has shown is that the majority of our schools have not really been strongly affected by COVID, because young people don't catch it as easily. So I think they're looking at that, but I do think, and I saw Dr. Richard Vesser he's now with the CDC, but he used to be the medical director for ABC News, and he was saying they really need to do that. They need to look at essential workers, people that work in our grocery stores, that work in our pharmacies, that work where people have had to go. We've done healthcare workers, but a lot of those other people are low income, and they really should get help as quickly as possible.
You mentioned the state has been using the age. Essentially, it's down to 65 now.
Yeah.
One assumes 60 will be the next
It will.
rung. But is there anything the General Assembly can do to change that formula or that procedure?
I guess we could, but again, I think that's why we pay Dr. Box the big bucks.
Yes.
Is to rely on her expertise, and Dr. Weaver, who works with her on this. And so, yes, we could, but I don't know that there's been any bills filed to do that. Right. But I have expressed my concern to Dr. Box and to the State Board of Health that they should consider this as quickly as possible.
I will let our radio viewer or radio listeners know that this is Lawmakers on WNIN FM, and our guest this week is Indiana State Senator Vaneta Becker. Well, let's talk about Senate Bill 36. I believe this is a bill you authored that would set up a psychology interjurisdictional compact. I believe it passed the Senate this past week and is headed to the House. Exactly what kind of compact is this? What would it do?
Well, basically what it would do is it would allow Indiana to join the psychology compact. I think there's about 15 other states that are already in the compact. That way, professionals that are licensed in other states could come to Indiana to work. It would help. We have a real shortage of psychologists and psychiatrists, and it would help in that area of healthcare to bring more people into the state. People would be able to work from Indiana and other states, but other states would be able, people that are licensed would be able to come and work in Indiana.
I see. And there's also a physical therapist compact, I believe.
Yes.
Senate Bill 305 covers that.
Yes.
Is that the same sort of idea?
It is the same sort of idea, so that physical therapists could cross state lines and bring more people into that field. I also have a bill on occupational therapy. It's not a compact bill, but what it does do is it changes the law so that occupational therapists can work on someone 42 calendar days without a referral. And currently, physical therapists can already do this. So this just brings the occupational therapy into the same line with physical therapists.
All right. We just can't get away from COVID, of course. It's a major factor in everything that's happening these days. Senate Bill 1 has moved to a House committee now. It would provide civil immunity in reference to COVID. Do you believe that's an important measure?
I think it's important, but I think we really need, some of that language needs to be improved, because I'm very concerned. I do not want people, in particular nursing homes, to get off the hook if for some reason someone, and I got an email from a constituent that was passed along to me. Her mother was in a nursing home locally, and I don't know which one, but she ended up very frail. The family couldn't visit for 2 or 3 months during all this, and she ended up with a very severe bed sore, and she ended up in the hospital, and then they took her back. She was very frail, and she died within a week. So I think that some of the terms in the bill I have concerns with. I support the general concept, but I just want us to make sure that we're very careful.
And that concept, again, when we're talking about civil immunity, that essentially means that certain businesses won't be responsible for...
Well, because COVID, I mean, and there haven't been a lot of lawsuits. I will say that. There really haven't been. But I think businesses are very concerned, and this applies to schools as well, that with somebody saying, I got COVID at your facility. Well, there's really no way to prove where you get COVID because it's in the air. And so...
right.
I don't think we'll see the massive lawsuits, but it is a preventative measure, and I certainly do support that. But I just want us to be very careful when it comes to medical. I do not want hospitals to be able to blame COVID for something that happened in their facility, like amputating the wrong leg
Right.
and different things like that. So, and nursing homes, I don't want to, I want them to adequately staff nursing homes so that people are well cared for. There's been some articles in the Indianapolis Star about that issue, that they're not adequately staffed. But I think the majority of them are, and I think sometimes you can sensationalize issues, but we want them. And I think because so many deaths occurred in long-term care facilities,
Right.
there is a focus on them. And we did pass a bill out of health this week and I went on the bill, I'm a co-author, that provides for visitation of your relatives
Right.
in nursing homes. That was one of the worst areas, I think, because a lot of people in nursing homes, when they were kept away from their family, and I know that's what the CDC said should happen, but a lot of them, their cognitive abilities have suffered a great deal.
Yes, we've seen a lot of that. I can vouch, even in my family, we've seen a similar situation. You mentioned that K through 12 education is a big issue of yours. There are several bills at the State House that want to expand school choice vouchers by raising some income requirements, giving more state funds to private schools. What do you think of those ideas?
I don't support them. When the concept of the choice scholarship started, it was supposed to be for low-income families. It's never been just for low-income families, and now they want to expand it to a family that makes $144,000 a year. And they're already sending their kids to a private school, and I think people that want to send their children to a private school should certainly have that option. That should be their choice, but I don't think it should be at government expense, because public schools, 93% of all of our kids go to public schools, over 1 million.
Right.
And we have not kept up with inflation. We have not kept up with the cost. We don't even provide free textbooks.
Right.
And yet we're going to raise income levels. I won't be supporting that for sure.
All right. Senate Bill 233 passed the Senate overwhelmingly. It tweaks the temporary for needy families. Could you explain exactly what that does?
Yeah, right now TANF is Temporary Assistance for Needy Families. I'm actually a co-author on that bill. And the amount that a family, a parent with 2 kids can get is $188. It hasn't been raised for years, and in fact, it's my understanding the state had a grant for $250 million last year for TANF and didn't even spend $50 million of it. And so what this would allow is to increase that benefit a little bit so that families, it's always been temporary. You can only stay on it about 2 years. And so I think it's a very positive thing to do to help low incomers, in particular when you have single moms with kids, and that's really where it's focused. But it's not permanent. It's only for short periods of time, and the maximum time I think is 2 years.
Now, I know you're serving on several committees, and I'm sure you have some initiatives that you're looking forward to promoting as we hopefully emerge from the COVID crisis. What are some of the other priorities, that you see as you see
Well,
it?
you know, I'm also working on a bill, telehealth, and I think that's very important. We have passed that bill, and basically what it does, and I was one of the authors of that bill, is it allows all licensed practitioners to provide for telehealth, including physical therapists, occupational therapists, even psychiatrists and doctors, physicians. It's a choice they have. I know during the pandemic, I was sick over the 4th of July, right before the 4th of July, and I used telehealth to get a prescription for a Z-Pak because I didn't want to go for the 4th of July, be among people and
Sure, especially during a pandemic.
and make other people sick. So I wanted to make sure, and I couldn't get into my doctor because she was off. So they allowed me to use telehealth. And, for a lot of issues, it's just the way that things are being done. And I think it's helpful. It doesn't take the place of the relationship between you and your physician.
Right.
I still think that's very critical.
And what is next on the telehealth measure?
Well, that bill has passed. It's over in the House, and it expands telehealth so that all of those, the governor's orders, he actually gave orders on telehealth during this pandemic so that people could use them. We've put into the statute and added other practitioners to it as well.
A few measures that have been talked about at the Capitol. We have just a minute or two left here. Some rioting bills, essentially cracking down more on rioting. It's also raised some freedom of speech issues. What are your thoughts on those
I really
measures?
haven't seen those bills yet, so I think peaceful protest. We shouldn't endanger peaceful protest. If someone is breaking the law, I think if they're destroying property and hurting other people, those are crimes, and they should be enforced.
All right, we will have to stop it there. Thanks again for being with us
Thank
this
you.
week, Senator Becker. Next week, our scheduled guests are Indiana State Senator Mark Mesmer and State Representative Wendy McNamara. I'm John Gibson of WNIN FM. Thanks for joining us for WNIN Lawmakers.